here in Berlin at the second meeting of how to diagnose and treat multiple myeloma. And today we spoke about imaging techniques, in particular about the functional imaging techniques, that is to say PET-CT and magnetic resonance, MRI. And so we had an overview how to use them to stage patients at diagnosis and during the relapse phase of the disease, highlighting the fact that these techniques are not only useful to identify bone disease but also to predict prognosis. And in particular, the number and size of focal lesion is of prognostic meaning, and also the presence of extramedullary disease. And at the same time, we are able to use this technique to evaluate the response after therapy and to follow up the patients. And nowadays it's particularly important after the International Myeloma Working Group stated the importance of evaluating minimal residual disease outside the bone marrow because of the spatial heterogeneity of the disease. So we may use these techniques, and the technique with the highest experience is PET-CT. We have several independent prospective studies evaluating the role of PET-CT in this contest. But we may also use diffusion-weighted MRI, and we have less experience but very promising one for the identification of residual disease. So patients who are not completely negative, have a negative imaging after therapy, display a worse prognosis as compared to the patients that are completely suppressing either tumor metabolism or bone marrow infiltration. And so these are acquired and validated points. And lastly, we also look at what is still needed for a widespread use of this technique, and in particular this is the standardization of these two techniques that is ongoing. There are several efforts for this. The comparison between, for example, PET and MRI to understand if we need both or one is better than the other. And the application of this technique in clinical trials to understand if we should or not tailor treatment on these techniques. So these are still open points without answer that will be probably addressed in ongoing clinical trials.